Welcome to the Big C podcast series, an initiative of the Algo FM Big Walk for Cancer. I'm Caroline Kelleher, and in part one of this episode, we are taking a particular look. Let's try that again. Welcome to the Big C podcast series, an initiative of the Algo FM Big Walk for Cancer. I'm Caroline Kelleher, and in part one of this episode, we are taking a look at childhood cancer, with a particular focus on those in our country who rely on the public healthcare system for treatment. It is a great pleasure to have joining me in the studio someone who has been an activist for better services for childhood cancer for 15 years, and who is also a member of Siyavuka's Exco. Estelle Ellis, welcome. Thank you for being here.
Oh, thank you for having me.
Right, Estelle, the introduction to what Siyavuka For Kids, the NPO, is about on your website is a sobering one, and I want to read it. Across our communities, children are silently battling serious illnesses, and they need our help. In the Eastern Cape, it is estimated that over 400 children should be diagnosed with cancer each year. Sadly, many of these cases go undetected due to misdiagnosis, limited access to healthcare, and systemic failures. As a result, countless young lives are lost unnecessarily. Siyavuka For Kids was born out of the urgent need to change this reality. Estelle, no mother we know should ever hear that her child has cancer, but it happens. But that a child's survival should depend on the circumstances they were born into is an egregious situation. How did we get here?
Yes, I wonder as well. So a lot of people would remember during our time when we had COVID, we lost our leader in pediatric health services in the public sector, Professor Lungile Pepeta, to COVID. But I want to say this, that the late Professor Pepeta always said that the care that a child receives should not depend on the income of the parents. Sadly, we know our public health sector is under severe pressure, and a specialist unit like the pediatric oncology unit, it's an expensive thing to run. Chemotherapy is very expensive. The children needs expensive treatment. You need frequent visits to the hospital. Children need healthy food. So it becomes in a constrained economic environment as we have in South Africa at the moment. Cancer just becomes such a huge stress on our communities and on all the systems around it, the health system, the social system. And I think all these things work together to create this, let's just say it, treatment of cancer children in this province is in trouble.
Which is really, really sad to hear. Because what happens is it's the whole family gets affected when a child is diagnosed. A parent may lose their job because they have to constantly be there for the child to bring the child to hospital. Estelle, can we start, because we want to educate folk, because so many of these cases, as we've now heard, are going undiagnosed. What are the most common childhood cancers?
Okay, so I just want to say before I explain that the cancer doesn't have a very specific, early cancer doesn't have a very specific symptom. So we don't want to cause panic, because a lot of it does look like the flu or other childhood diseases. So when we say this, we do mean not to panic, but just if these are chronic symptoms that you see in a child, that you need to get them to a clinic or to another public health facility that can assist. But just because the child has the symptoms doesn't mean the child has cancer. The child can just have the flu or the chicken pox or something else, pink eye. But okay, so in general, and I think, every mother will know, kiddies do sometimes mask their symptoms, right? So they carry on, and children are so resilient that you need to also pay attention to your child and see if there's something that goes wrong that's quite chronic, that keeps on, something like backache, for example, bone pain that doesn't go away, that's not maybe connected to a growth spurt, pain in the tummy, abdominal pain, swelling that doesn't go away, or it's not like linked to something like food poisoning. I think any unexplained lumps or swellings that doesn't, you'll know if there's an injury, maybe if they fell or so, not that, but if there's suddenly a lump that you don't understand, especially if there's, if children have difficulty to go to the toilet, I think, if there's blood in the urine, that for me, that's immediate red flag. I think
headaches? It's unusual for a child to have a headache, isn't it?
If headaches don't go away, unexplained seizures, also a major red flag. But it can also be something very small. We had a little patient at the ward who her nose just started bleeding. That was the only symptom. And she actually had quite an advanced state of leukemia. So if a child a lot of parents have told me that the red flags for them was unusual paleness in a child and also back pain in a child, and children that are not full of energy. So kids that are usually quite vibrant and run around, that suddenly just come back from school and just sleep all the time. It's difficult if it's a teenager, right? So you don't know if it's teenager related, but in younger children, if they're not filled with the sort of normal happiness in life and filled with energy as they usually are. But as you can see, these things are difficult, and because they can actually mean anything. So, but I think a mother will also know, this one doesn't look right. I think if you feel uncomfortable, especially if something's chronic, then try to access a GP at your local public health clinic or at your own GP.
So that is great if you have access to a GP, you have medical aid. But Siyavuka For Kids, you function to assist those in need. So how do we get the word? How do we educate rural areas? How do we, that's what's happening. People, because of the circumstances they were born into, are not receiving medical care. So how is Siyavuka For Kids filling that vital gap?
Yes, so we are planning a program to go out and educate in the rural areas, especially where people need to access, say, healthcare in Afrikaans or in isiXhosa. They sometimes struggle in a city clinic or to explain themselves. So we are planning to do an outreach program where mothers who have a concern can come and say, well, that is part of our early detection, because early detection, like with adult cancer, that is really key for recovery and for a successful outcome.
So how do you, at this point in time, do you provide support to the pediatric oncology unit at Provincial Hospital?
Yes, so I must just make this clear. So pediatric oncology, let me just quickly talk through the state sector, right? So we will, let's say you have a concern about your child, you need to take your child to a clinic first. The clinic will refer for tests to the general pediatricians. The pediatricians who are at the stage that's based at Dora and Ginza Hospital, they will do the necessary tests, and then they will refer up to the pediatric oncology unit. It's a specialist unit. You can't access the services for directly. You need to be referred there. So the first thing I want to say is if you're concerned about your child, you can't come to the unit. You need to go through the steps first, because we support the treatment. Children that are in treatment,
yes.
So they've already been diagnosed, but they're now being treated for pediatric cancers.
So what is your role in terms of the doctors at the unit? How do you liaise with them? What do you do in terms of the kids who have been diagnosed?
Okay, so we provide support on a number of different levels. Firstly, we provide emotional support for the doctors and for the health staff. I think anybody who has ever been to a cancer ward will know that it is a place of absolute heartbreak, because you have these children that are so brave and they fight so hard, and the outcomes are not particularly good in Africa at all. The continent, but also in South Africa. Children are diagnosed late. They get very sick very fast.
Sorry to interrupt. Is this the reason, Estelle, that the diagnosis, it's taking place too late? Because childhood cancers, is there generally a positive outcome?
The childhood cancers, in general, the outcomes are better in first world countries.
Okay.
Close to, I think it is around 80%. But in Africa specifically and in South Africa, I think we'll be lucky if we get to 50. A study done a few years ago have put out, that's 2014, that's also a long time ago, but I don't think things have changed. In fact, things might have gotten worse since then. I've put out childhood survival, the survival rate for children with cancer at 52%, which is low. So it means 1 in 2 of them die. But late diagnosis is one. Problems to stick with treatment, it's very heavy on the family, is another. But usually, I think the majority of cases, children arrive when they are already very sick.
That is so sad.
Yeah, it's heartbreaking.
So in terms of the funds that you raise for Siyavuka for Kids, what is the money? Is it mainly medication, those kind of those material medical needs?
So one of our principles is that we have a memorandum of understanding with the health department, and we let them do their work, because I know a lot of people will say, but the health department's already taxpayer funded, which is true. So we let them do their work. But we do understand that this is a very underfunded mandate. In public health is vastly underfunded, and in the Eastern Cape it's even worse, because there's a dispute about how many people actually access healthcare in this province. And the argument from province is that we are not getting all the money we should for people who maybe come home or bring their children home when they get sick. So what we do is we let the Eastern Cape Health Department take care of the basics. But there are things that are best practice that the Eastern Cape Health Department cannot afford, or it's not within their supply list. One of them, for example, is nausea, an excellent but expensive nausea medication. There's a plaster that we use on drip sites that is not on the government's list of things that need to be supplied, which is it's like an antibiotic infused plaster that prevents drip sites from becoming infected. For example, a cancer ward needs to be deep cleaned at least once a year. We pay for that. We put water filters in, because you must understand, when a child gets chemo, they have no immune system, so they get sick very fast. Then we also provide nutritional support. A lot of children come from very, very poor families, and when we are alerted to somebody's circumstances, we try to help. We have partnered in the past with SA Harvest on that. And then we also supply, if there is for instance, in the year, there was a shortage because of supply chain issues with Panado, which is pain medication that they give the kids, and there wasn't any. So then we are able, because we are more agile than government, to step in and say, well, let us get the Panado syrup, or let's get some blankets. Laundry is a huge problem in the public health sector, and also, the heartbreaking reality of living in the Eastern Cape is that a lot of families who access healthcare in the public hospitals have only one blanket. So when there aren't any blankets coming from the supplies, at the hospital, families either have to give away their blanket, go home without a blanket, to just have the child have the blanket, or the kiddie has to stay without a blanket. So we quite, for the sake of dignity for the children and also comfort, we supply blankets every now and again. But we basically there, because we're able to move faster than government. If there's a direct need that's fast, that we can do something, we do it.
Okay. Estelle, we all know you as a senior journalist at the Daily Maverick, and it must be so wonderful to be in a position of power to speak, to shine a light on so many of our healthcare system injustices. Can you cite any wins for us, or is there something currently that you are working on?
Yes, so I can I would like to highlight two stories. Daily Maverick, we believe we speak truth to power. We do not allow people to suffer on our watch. And this Siyavuka is my second job, so I'm just going back to my first job now. For instance, I think you'll remember it was quite well publicized. We had a huge shortage of chemotherapy in January, and we again had it in May. Now, this is it's too dramatic to say it's a death sentence, but interrupting a child's cancer can cause enormous health issues for that child. Let's just see on the emotional level, they take the kid out of school, must go for chemo, arrive here, because a lot of our patients come from far, from Grofrenet or from other places in the Karoo. Now there's no chemo. Or, kiddies might come from close by, but still they can't go to school. And also then their treatment then gets lengthened because they've missed the chemo. So it's a completely unacceptable situation. So we joined other parties to complain to the South African Human Rights Commission. But we also, at Daily Maverick, we also persisted, to report on why is there no chemo? And it's astonishing how many times down the sort of chain of messages from the top, we got the wrong information, that people were convinced that the chemo has arrived. And then when you went to check, there's nothing. And then there are more kids that then miss treatment again. So we were quite aggressive in our reporting on the chemotherapy shortages. And I'm very glad to say that got resolved, and a committee was appointed to ensure that this doesn't happen again. That was our one win. And then the other win, I didn't get to do the reporting, so I just did the stirring. When the phone lines were cut off because of non-payment of the phone bill.
Oh, it's just shocking.
It was.
Isn't it?
It was.
Shocking.
And people, doesn't mean you can just pick up a cell phone. You have to phone ambulances, you have to phone pharmacies, you have to phone DORA. And of course, if all the phone lines are cut off, then what do? You can't drive a sick kid to DORA to check if there's space for them in the ICU. You have to then try to track down people or call an ambulance urgently, say for someone who needs to go to the ICU, or patient transport for somebody who needs to go for radiology. So the phone lines were cut off also at the end of the financial year, and I was intending to do a big story, but before we could, the Human Rights Commission stepped in and they negotiated a settlement with Telkom and the Department of Health.
Great. Well done. Don't stop doing what you are doing. Estelle, the big dream for Siyavuka for Kids?
So we do dream big. We want to just start with pediatric oncology. But, everybody will know pediatric services seated at Dora and Ginza Hospital. We have a lot of specialist pediatric units who need the same support that we are giving to pediatric oncology, but now for different disciplines, right? So we've got pediatric orthopedics, pediatric neurology, but also there's the general kiddies that have to be admitted. We have a pediatric ICU, neonatal unit. So our big dream is to create something like a Red Cross hospital in Port Elizabeth or in Kelleher, where our children can be admitted and they don't have to be sent to Cape Town or to Joburg for specialist treatment. And where best practice, like we are trying to establish at the pediatric oncology unit, will be the way we work. And we want the whole community. I think this is the big dream, but I feel we will win if the whole of Nelson Mandela Bay gets involved in creating this. We've already seen that where people take hands with us, we do magic fast. Our Garden of Hope was established within 2 months.
That's at the Provincial Hospital.
It's at Provincial Hospital. As you look at the hospital on the left-hand side, we actually have 2 gardens. There's a garden there for moms and for nurses if you need a moment, which we call the Garden of Hope. But then we also started next to it. There's now the Garden of Growth, where we planted seeds. The children actually planted seeds, and they're busy coming up. So there's a beautiful garden waiting for people, to bring people joy and to also give them courage and hope.
It's wonderful. Wonderful. Well done to all of you. Estelle, when you say we need Nelson Mandela Bay to get behind us to make this happen, how? What do we do?
Okay, so we need commitment. I understand NGOs work in a funds-constrained environment at the moment. A lot of health NGOs have lost their funding from PEPFAR, which was the United States funding. So let's just say it. I mean, we talk about crisis a lot when we talk about public health in this province, but we are in a crisis and we do need to step up. So firstly, I think we need a mindset change. A lot of corporates want to invest in legacy projects and in education, and I think that's wonderful, but then we also need people to invest in our children that are sick, that cannot be educated. And you never know. A child might have a small setback as in the early years and become something amazing. So we really need to see, our corporates need to see this specific unit and our big dream of the Children's Hospital as part of the bigger education program and child services program in the province. I think that's the first step. But then also we have a wonderful community, caring community, and we are full of talented people in Nelson Mandela Bay, and we at Siyavuka For Kids, you can check on our website, we welcome volunteers. So I always tell people, you can do what you can, where you are, with what you have, and that's exactly what we need. If you, for instance, feel that you can pray for people, then tell us. We're quite happy. If you are a mother whose child have survived cancer, we would like to hear from you. How can you help? Because you've been through the wars. That we don't, for instance, introduce programs that mean nothing. If you can maybe, I just want to use an example of the owners of Sherwood Garden Centre who just stepped up. And they just, the next thing we asked, we had this dream of a garden of hope. Next thing we know, there's just like designs and plants and trees. And that's what we need. We have all the, I don't want to really talk about we have all the certificates and we have all the everything that you need for SARS, but we really need the will for people to say, here I am. I can maybe paint. The ward needs a makeover. That ward's getting a little bit old now. And then, so just if you know that you've got something to give, now is the time to step up. This is a crisis. We are unable to apply probably for most international funding because of the greater health crisis in Nelson Mandela Bay. But I feel it's imperative that we look after our own children.
Mm-hmm. Absolutely. Last words in closing, Estelle?
So 2 things. The one is, as part of as part of the dream, I want to also stress that, and there might be people that would like to get involved, we do need to establish a better palliative care program for cancer children. We know about half of our kids, this is what the statistic shows us, half of the children might not make it, or they will get extremely sick and they will need palliative care, to just see them out. I want to tell the story about this one child who was from the rural areas who he had bone cancer, got extremely sick. He was sent home. He was in so much pain, and they were taking him to the hospital on the back of a bakkie, and that's where he died. I can't stand around and have that happen to someone else. So if there are, people with expertise in palliative care or people who are willing to assist us, we need you to sign up.
Sorry, that's...
That is the worst story ever.
Sorry.
And, that child was so brave. He lost, his leg, and we don't want another kid to die like that. So,
Estelle, thank you for what you and the team at Siyavuka For Kids are doing. Don't stop.
No.
Don't stop.
No,
Thank you. Bless you. Thank you.